I'm Dan Kenner, and we're back with Dr. James Butler, who's an expert on bioesthetic dentistry. And we're finding out that bioesthetic dentistry is more than just the mouth. It's really the whole body's condition that matters. So let's talk a little bit more about how lifestyle can have effects on the teeth. You already mentioned that as we get older, especially baby boomers and beyond, there's more exposed and more delicate tissues that are exposed. So how does our lifestyle affect these adversely?
Well, it turns out, Dan, that most of the things that we enjoy tend to be acidic. You know, even green tea, which is very healthy, is mildly acidic, and a lot of things that we like, from orange juice to lemonade, are pretty acidic. So we can have a lot of challenges on those root surfaces once they're exposed. They're 40% softer than the enamel that was exposed when you're a kid and an early adult into your 30s. And it's not until you hit your 40s or 50s that you can have a whole new round of challenges, because these acidic things that we like and stressful lifestyles, some people grind their teeth, other people hurry through their routine of cleaning or don't have a way to strengthen their teeth. And especially if we're taking medicines that dry the mouth, now we've got a perfect storm of challenge to those root surfaces and to the dentistry that we have.
So things like soda pop and sweets and that kind of thing can create that sort of acid condition in the mouth?
That's true. And even things that are good for us, teas are acidic, lemonades, all kinds of things. Soda pop is fairly well recognized, but did you realize lemonade is 10 times harder on your teeth than soda pop?
Oh.
People don't realize that, and Red Bull's worse than that. So things that have a high acid content can really do a lot of damage.
So not necessarily the caffeine, but it's the acidity of it.
Yeah, but the dental part, absolutely. Plus, the caffeine can promote, if you have a tendency to grind your teeth, studies have shown a certain amount of caffeine a day will encourage that. So.
Well, I understand that years ago, soda pop, I won't use any brand names here, but soda pop had phosphoric acid in it, which is a very, very corrosive acid, and finally that got taken out. But today it's mostly carbonated, carbon dioxide. Does that have an erosive effect?
It's still acidic. It's carbonic acid is one of the byproducts of that. So naturally, anything that really tastes tart is generally acidic, and that's why it has that taste. So those things can have a damaging effect, so we have to do something to counteract those effects.
Now, I want to touch back on something you said earlier. You mentioned that gum disease can be a marker, it can be an early warning for chronic disease. Now, I think a lot of people who follow the health news know that gum disease can actually, bacteria that are in gum disease can actually migrate and damage the heart. Can you tell us a little bit about that?
Well, they've studied the link between the bacterial toxins that can get into the bloodstream from gums that are infected, and it turns out that can increase the incidence of a fatal heart attack in humans. And so, we strive to diagnose and treat gum disease as early as possible. And 3 out of 4 adults will experience some form of gum disease in their lifetime. So it's a fairly serious, absolutely.
So brush your teeth, kids, or you're going to get a heart attack, right? Well, what are some other systemic, some whole body problems that can be connected with gum disease or dental health in general?
Well, it's more of a reflection. If you have osteoporosis, that can show up in the form of receding gum lines and lack of bone density around the teeth. If you have metabolic problems, chronic diseases like diabetes, they weaken the gums.
So diabetes is an example of a metabolic problem, for example.
Absolutely.
Yeah.
So there's a number of things that can affect you. Heart disease is not in itself a dental problem, but the treatment of heart disease can be a problem, because the medications can create the dry mouth problems and can have adverse effects of the gum. So, treatment of disorders with medicines is a big problem.
So there are a number of drugs then that can damage the gums, and then that can threaten the dental health. And then the dental health can again threaten the whole body systemic condition.
Exactly.
So yeah, it becomes a sort of a self-perpetuating, doesn't it?
Well, and not to mention the fact that the chewing complex has a lot to do with digestion and nutrition, which everybody agrees is the best treatment for any disease is proper nutrition. So if the oral system isn't working well, then we're less likely to digest properly or to be able to eat things that are good for us, which tend to be, crunchier and more, less processed. And it's hard to chew those things when your teeth aren't working right.
Mm-hmm. Well, I think it's really important to get this information out, especially to baby boomers and people who are facing advancing age, because there's a lot of new technology that's available. There are, it sounds like you've got a lot of methods that can actually help people live longer lives. When you hear the term bioesthetic, it sounds like it's just looking pretty, but
right.
It's really much more than that.
Yeah, bioesthetic means that it looks good because it's biologically correct, okay? Mm-hmm. And what we studied was that the people that look natural also can chew properly and have systems that hold the test of time. I mean, I have patients that are 90 years old with a full set of teeth. Now, if we could reproduce that in everybody, we wouldn't have 5.5 million Americans getting dentures every year in this country.
You ask them what their secret is, I suppose, when you have a full mouth like that at age 90.
Exactly. Well, and a lot of it is heredity, but also, good tooth alignments. A lot of these people have had braces. Good dental care, preventive examinations and mm-hmm. catching problems early. Mm-hmm. Those are some of the things, good habits,
Mm-hmm. It's back to lifestyle habits again, isn't it?
Yeah.
So we're talking with Dr. James Butler, and we'll be back shortly.
Oh, hey, Mark.
Hey, Mark.
Hey.
Where have you been?
I lost my cat.
Oh, that's not right.
Yeah, so I made this cat magnet to try and get him back.
Cool. Does it work?
Kinda.
Nice.
Yeah, but that's not my cat. Gotta keep working on it. See ya.
See ya.
Anything's possible. Keep thinking. Get started on your own inventions or just play some games at inventnow.org.
Welcome home, man.
When life's this hard, graduating can be even harder. But you can help Jose and the students in your community make it through by visiting boostup.org.